really appreciate NIAA's efforts over the years to bring people from different backgrounds and different perspectives together to understand what is often a very complicated issue around antibiotics and antibiotic resistance. I guess I will start by saying I think we all appreciate that antibiotics are incredible medicines that we use to help animals and people stay healthy or to become healthy. And I really liked Dr. Braden's comments that antibiotic use must be both judicious and responsible in treating disease for both humans and in animals. And I think that's really the reason why we're all here today, is because we're committed to that function. And as a veterinarian, I have to say that while I've been involved in animal agriculture for multiple decades, I understand that while we're ultimately producing food, as well, we are raising animals. And it's a commitment to the health and welfare of those animals that I think we also have to keep in mind, even as we tackle some of the complex issues around antimicrobial resistance. Last year, we, at our symposium, the NIAA Symposium, as has already been stated, the title was From Metrics to Measurement. And coming out of that symposium, there was a straw man build of ways that we might consider in animal agriculture in creating metrics that might be useful towards decreasing antimicrobial resistance. So since only a few of you were at the June Roundtable, I wanted to share with you, firstly, what were the metrics that were presented coming out of the meeting a year ago, and what was the discussion in June about the applicability of those metrics. So these were potential stewardship metrics that came out of the 2015 NIAA forum. The first stated, the first metric or goal was to have to look at the percentage of states that had a working One Health committee overseeing the collection and dissemination of data on antimicrobial resistance from human, animal, and environmental sources, as we recognize that antimicrobial resistance also came from environmental sources. And in the discussion in June, what came out of that was there was a general sense that while a laudable goal, probably didn't have a real immediate value from the perspective of antimicrobial resistance. So what was suggested was that metric be revised to looking at the percentage of producers with stewardship programs. Stewardship programs, the definition of which is yet to be determined. The second metric coming out of the meeting last year was the number of useful or practical new diagnostic tests for the rapid identification and characterization of antimicrobial resistance and infection in veterinary medicine. And once again, in the discussion in June, there was a sense that, again, probably wasn't going to drive value in terms of decreasing antimicrobial resistance in the short run. So instead, it was suggested that we focus on the percentage of treatment decisions that are made through the guidance of diagnostic tests. The third metric that came out of the symposium last year was the proportion of production units, animal production units in the United States that have a documented veterinary client-patient relationship, which should be 100%, correct? Since most of those units have some sort of prescription or soon restricted, if you will, use of antibiotics. And that was not changed. And the final metric that was proposed a year ago was the one around the degree to which new alternative interventions were being used by veterinarians, and that was still thought to be a useful metric. But so often when we're talking about metrics, what we're really talking about is antibiotic use metrics, very specifically. And so there's been a lot of discussion in the intervening year about the development of those metrics. Certainly There are some people who believe that we should know exactly how many kilograms of each type of antibiotic are used for exactly which purposes in exactly which production units in the United States. Maybe a laudable goal, maybe not. There are several questions that I would suggest to you that we really need to answer when we think about metrics, antibiotic use metrics, in our production facilities in the U.S. I think the first question is why? Why would we have these metrics? What is their purpose? What exactly should those metrics be? How are we going to collect that data? And who's going to do it? So in a nutshell. And so again, what's the goal? If we're going to ask producers to collect some sort of metrics, what is the goal that we're shooting for? Are we going to ask producers to collect metrics in their ranches, in their feedlots, in their production units with an ultimate goal of decreasing antimicrobial resistance among human pathogens? Because indeed, a lot of the discussion that has gone on in the popular press certainly is around the use of antibiotics in animal agriculture and its potential impacts on human pathogens. Is it because we want to look at decreasing antimicrobial resistance in animal pathogens? So exactly what is the goal? Unless we articulate that well, I suggest that the opportunity for compliance will be decreased. The quality of the data that we'll get will be less. Another question is, are we willing to decrease the status of the animals that we're raising? So in the name of decreasing antibiotic use, is in some ways that impacting the health of animals? I would suggest that most of us believe that animals, if we're going to steward them for our food, that indeed they have the right to be treated with medicines when they get sick. How will the metrics be collected? So there's an assumption, sometimes, I would say typically for lack of knowledge, that all you do is touch a button and all the metrics on the use of antibiotics in any given production unit will flow. That's certainly not true. We have many, many production units with animal health information, electronic animal health information systems, but not all of them are geared to be able to create the kind of reports that we're asking for, and to what degree, even if we create that report, can that data be aggregated in some sort of regional state or some other process? I guess the other question is, what's the optimal amount of antibiotics that we ought to be using in animal agriculture? Is less better, necessarily? If we use less and we don't affect cures of disease when we use an antibiotic, is that good? Or should we use more complete courses of therapy and ensure that those animals are cured? Who's going to do this? Is it going to be the veterinarians who are going to be responsible for this? Since they now will oversee the veterinary feed directive as well as prescription antibiotics. So how will vets do that if we expect them to do that? Is government going to do this? Or should we expect the animal protein industries to do this? And what about the costs to create the systems to garner these kind of metrics? So, as we've looked at this metrics, and of course we now have a federal requirement for the animal health companies that produce antibiotics to report annually how much they manufacture and sell, and what types of production units are they going to? The swine, poultry, cattle. Is there a difference between the amount that's being produced and sold into distribution from the amount that ultimately makes it either into a veterinarian's hands or into a production unit's hands? Should we be keeping track of the amount that's prescribed, either through a prescription or the soon-to-be VFD? And how much of what's prescribed is actually used versus discarded? So these are all questions that we really need to ask ourselves. What are we going to exactly measure? Are we going to measure the amount per production unit per year? That's certainly been described. We've seen some press releases around reduction of some percentage in the use of antibiotics in production units or in a group of production units? How about should we looking at the amount that we give to an animal each year on a per animal basis per year? How about the total doses per animal per year? What about the differences in, so if you say, well, if we aggregate all the milligrams that we give to an animal when we give a course of therapy and we multiply that times the number of animals that got the therapy, we're going to get this large number, theoretically some large number of kilograms of antibiotic. But is that really telling us what we need to know? I'll give you an example. We have 4 different injectable macrolides available for the treatment of bovine respiratory disease. And the dosage per kilogram body weight is different. So we've got one of these macrolides that's 2.5 milligrams per kg, another macrolide is 4, another macrolide is 6, and another macrolide has a range of 10 to 20. So if we start counting up kilograms of the use of a particular macrolide, is that a fair comparison? Should we switch everybody onto the lower dosage per kg? Does the outcome make sense? And what about the frequency of treatment? Some of these antibiotics require daily doses. Some antibiotics you can give a dose and that dose is effective for multiple days. So comparing one type of antibiotic that takes 5 daily doses with another antibiotic that only takes 1 dose, is that a fair comparison? So I'm not to suggest that these are the right metrics, by the way, but some people have tried, in fact some countries have tried to define what the right metrics should be. So we have things like animal daily doses, which came out of Denmark, which is very similar to the defined daily doses that are used in humans. We have a defined daily dose in animals. We have defined animal daily dose, which, if you're going to compare a daily dose on a 600-pound steer, by definition, that's going to be different than a 400-pound steer. So is that equivalent, or should we try to use some sort of system to say, well, a 400-pound steer, by definition, will only take 2/3 the amount of antibiotic to be treated than a 600-pound steer? So it gets pretty complex. And some have suggested maybe that we have some sort of defined course dose based upon average body weight or some sort of body weight standard. So I think the important thing for me as I think about the metrics, while they can be very confusing, is that they really are particularly, in my mind, not salient unless we look at the metrics and look at the outcomes. So we can look at the antibiotic inputs for health maintenance, but what are the health outcomes? So for me, anyway, I go back to the statement here around professional organizations recommending that antimicrobial stewardship really needs to measure both antimicrobial drug use and also on clinical outcomes. And so you might get some sort of a metric like defined animal daily doses or course doses per animal cure or per animal treated. There are a number of those. So it's if nothing else, I hope I've gotten you to think about how complex this issue of metrics actually is.